Hi everyone, I'm Dr. Toor from Amplify Eye Care here in Olympia, Washington. And today we're going to talk about color blindness, or better termed as color deficiency. So color deficiency is usually when someone lacks the ability to differentiate between certain colors. And just to kind of give you the basics, color is perceived by your photoreceptors in the back of your eye. There are two different types. Rods are the photoreceptors that are responsible for your night vision and being able to see in the dark, whereas cones are responsible for seeing in the daylight and being able to see colors. So when someone has a color deficiency, there's usually an issue with some of the cones perceiving certain wavelengths of light. And the reason why deficiency is a better term is that most people with color blindness are not actually seeing the world as black and white. They just have a decreased ability to differentiate between certain colors. The most common one usually being red and green. And so for color deficiency, a lot of it can be genetic. So usually if it's inherited, it's mostly males. I think there's about 8% of males that are color deficient, whereas it's super rare for a female to be, and that's usually less than 1% of the female population. Now, color blindness can also be inherited just throughout your life or acquired, and that can be due to several different reasons, such as like optic nerve disease or atrophy. There can be different medications, stroke to the eye, or toxic materials that can end up causing color deficiencies. Now, when it's acquired throughout your life, that can be one eye or both eyes. But if you're born with it genetically, that should be bilateral, as in both eyes are affected equally. Now, there's a few different types of color deficiencies. One of them is deuteranomaly, which is a hard time picking up green wavelengths. Protanomaly is picking up, or harder time picking up, red wavelengths. And then tritanomaly is the most rarest one, which is picking up blue wavelengths. And usually tritanomaly is the one that's mostly acquired and not actually inherited genetically. And then just to give you an example, so if you were to come in and you're wondering if you have any color deficiencies, the simple, most easiest way for us to check here in the office is using a color test book. And just to kind of show you, so this would be the first page, and usually the first page is just the test page, and everyone should be able to tell what that number is. And then if you start flipping through, it gets a little bit trickier, but most patients without color deficiency do just fine. But there are certain colors and numbers that you might be able to see that have like different colored circles within them. So certain types of color deficiency wouldn't see this as a 5, but they might see it as a different number. And then others might just see it kind of as blank. And there's multiple different ones here. These ones are a little bit tougher to see. But yeah, we can go through the book, and different plates mean different color deficiencies, but that's the easiest and best way to get that diagnosed. So if you do feel like you're having trouble differentiating between colors, always contact your eye doctor and they can check that out for you.